Hello, and welcome to the Clinical Liver Diseases video series. CLD is an official digital learning publication of the AASLD. I'm Robert Mitrani, and I'm one of the authors of A Transition of Care Model for Pediatric Patients with Non-Alcoholic Fatty Liver Disease. Today, I'm delighted to share with you our proposed model for transitioning patients with fatty liver disease from pediatric to adult care. Transition of care is defined as the purposeful, planned movement of pediatric patients from child-centered to adult-oriented care. The concept of transition of care developed over the past 20 to 30 years when physicians realized that children with chronic diseases such as sickle cell, diabetes, and inflammatory bowel disease experience increased hospitalizations and decompensating events late in adolescence and in early adulthood. In our article, we propose a transition of care model specifically for fatty liver disease, a condition that often goes undiagnosed for many years and with the potential to progress to cirrhosis in adulthood. Our model incorporates education about fatty liver disease and transition of care early on in the process. The model also addresses obesity, self-esteem, and self-efficacy. Self-efficacy is the belief that people can accomplish tasks and conquer challenging situations ahead of them. Not only is self-efficacy helpful for weight loss, but also it's been shown to be correlated with transition readiness for adulthood. Before entering adult care, all adolescents meet with a transition coordinator who runs through a checklist to determine if patients are ready for transfer of care to the adult side. These checklist items include knowledge about fatty liver disease, independent healthcare behavior, sexual health, psychological support system, and educational or vocational goals. Our transition program ensures that patients build skills of independence and responsibility before entering into adult care. Once adolescents are ready for transfer of care, they are paired with an adult provider before their final pediatric visit. This connection allows adolescents to feel more comfortable entering into adult care. In the adult setting, patients are triaged based on their past medical history and transition checklists to determine if further steps are needed to successfully integrate them into adult care. Some patients may require referral to other specialists, while other patients may need more education regarding fatty liver disease and appropriate management. Once patients are settled into the clinic, they complete surveys relating to self-efficacy, quality of life, and satisfaction with the transition program. Finally, patients are reviewed with pediatric colleagues to determine areas for improvement regarding transition of care. Improvement is gauged by patient attendance at clinic as well as their survey responses. Clinical, laboratory, and imaging data are also analyzed. Taken together, this data helps us determine if the transition program is working and how we can improve the program. With the development of a comprehensive model for transition of care, we hope to create a durable program by which patients are encouraged to take ownership of their health care and live happy and healthy lives. On behalf of all of us on the CLD team, I hope you found this description of a transition of care model for fatty liver disease useful. For more information about transition of care in fatty liver disease, please visit cldlearning.com. Thank you for watching.